Yeah, no, I'm good, thanks, Steve. Good to be here.
Busy morning?
Yeah, mad, mad. Actually, to be perfectly honest, this is not a good day for me in terms of laser. I've been Mr. Rehab today.
Oh, really? Okay.
So I've used the laser once this morning,
Okay.
which is very unusual for me.
I'll put you on mute then.
Yeah.
Fine. See you again. No, it's fair enough. It happens, doesn't it? Funny enough, we asked you that question last time, how frequently you used it.
Well, I use it so much normally, but this morning I've had what 7 patients, and just one I've been using the laser on. The rest have been in the gym, and I've been beasting them.
Okay, well done. Good. Well, whatever it takes, I guess, as long as
Well,
they.
yeah, exactly. It's what they need, and that's the whole thing. And a lot of these, I probably have used the laser on them, most of them, but we got to the stage where they need beasting.
Okay.
So.
Well, if we've got time at the end, we'll let you define beasting at the end.
I think any physio out there should know what beasting is. If they don't, direct message me and I'll show them.
Okay, good. Well, and listen, it's good to see you. It's been 2 or 3 weeks, hasn't it? We haven't seen you for a while. So good to see you. A lot's happened since I last saw you. We've got a couple of firsts in the ASA world, the ASA Laser Superstar world. We've got our first Southern Island laser person, laser clinic, I'm delighted to say. So I'm delighted with that. So the in podiatry, that is, first Southern Island podiatry. And we've got our first M6, the robotic unit out there with a podiatrist. So the podiatrists are leading the way. So that's my bit of news for you. So guys, I can see a couple of chats coming in, so I might have a couple of questions. I'll get one going for starters, get you warmed up, Paul. We've got lots of questions. You mentioned there actually, this morning hasn't been a day where you've used the laser that much. I know in the past when we asked you, it's something you do use a lot of, obviously. But can you just talk about, most of our users have just got the handpiece. I say just the handpiece, it's brilliant and it does what it does, the M-Phi. But you've obviously got the Charlie head. How many times when you're treating do you feel the need for the Charlie head? Can you put a ratio on it of Charlie head with the handpiece? And I think also, can we just talk around the importance of maybe using the two together as opposed to one or
well, yeah, what's the ratio? I would say most of the time I use Charlie head with the handpiece, but I'm using, see, you don't need to. What I've always said in all my talks is what we want to do is we want to do the area mode, i.e. the global approach, and we want to do the pathology stuff as well. So we treat all around the area, all the muscles which are connected with the joint or the problem that there is, to try and get some photobiomodulation, to get some vasodilation, to get some ATP into all the surrounding cells, which just brings everything to life. And then we want to get on to the pathology setting. Now, very simply, what you can do everything with the handset. It's very simple. You scan first and then you do the pathology. For instance, if you had a I don't know, let's say the foot, something problem in the foot, you've got a lot of podiatrists there. We're talking about a lower limb scan. We are talking 4 minutes, and I would generally say most of your pathology settings are going to be generally around about between 5 and 7 minutes at the very most. Okay, so that is, you've actually now got this massive problem of, if you take the longer one, 7 minutes plus a 4-minute scan, you've actually got 11 minutes of work, which is a nightmare. I will make this down to literally 7 minutes or 6 minutes just by using, at the same time, I'll set up the Charlie head to get the vasodilation into everything around there. And then I'll be doing the pathology at exactly the same time. So I'm saving 4 or 5 minutes, which at the end of the day, I'd sort of tried to make this sound, basically it's nothing, but I'm still doing things a bit quicker. Where the Charlie head has its uses, and it doesn't happen with everybody, but where there are phenomenal little advantages is I can actually treat I can treat a knee and I can treat a shoulder at exactly the same time, because I can just do the settings and set them up and do what I want. Okay, so I can still do, let's say, a scan. If I was doing a knee, I'm doing the scan on the quads and then the calf muscles, and I'm doing the pathology with the handpiece. And then what I'm doing with the shoulder is probably spending 10 minutes on the shoulder, 3 points round there with the Charlie head. So I'm therefore then in just over 10 minutes, I'm treating 2 parts of the body very effectively.
Brilliant. Okay, thanks, Paul. Now that's great to hear, because I mean, the question came from someone who is considering upgrading to have the Charlie head. So I think, you know, understanding how it helps you in practice is...
Yeah, I think, I mean, the great thing about it is an upgrade, and it's a very worthwhile upgrade, but you don't need it. No. What I would say is it will make your life so much more special if you do have it. I don't know what you guys charge for the Charlie head. I don't think, but from what I remember, which is 8 years ago, it didn't cost an awful lot more. It's not as much, anywhere near as much as the whole unit to start with, and then you add this on, and you're getting the full package, where you can do anything. You can sing and dance. It's got a mini bar, fridge, cinema, there's a lot in it.
It's the tea. It's, yeah. Put your feet up. Well, I mean, with the trolley, which some people already have the trolley with their MFI unit. But you have to have the trolley for the ultra head. That whole additional equipment is another £4,000. But the good news is you can upgrade on the units that they've already got. So there's no catch, or you should have decided at the outset you've got the wrong unit. They've got 2 channels on, so you can upgrade, and there's no there's no incentive. You know, I think we're a pretty fair company. There's no incentive to buy it up. We don't do a better deal up front. You know, get it when you want it, if you want it, and there's no, or you know, I'm now paying more for it. So that, you know, we try to be fair there. So yeah, no, that's great. Thank you. Okay, 1 or 2 questions specific around treatment now, if we could, please. I would like to know more about the effect of low hertz versus higher hertz. We know low hertz penetrates deeper and better for more chronic conditions. Can you explain maybe the theory and the advantage of choosing one over the other?
Well, I think with the hertz, it really comes down to you're getting more of a mechanical advantage with higher hertz. If you ever look at the settings of this, let's say, for instance, if you just look at edema, it's where we want to start flushing everything through. And I think off the top of my head, I think the setting is 2000 hertz. The one thing I always do say to people is generally, and again, it's a very general rule, but in an acute situation, lower hertz, lower intensity. In a more chronic situation, higher hertz, higher intensity, which will then equate to higher joules and everything. Again, not always true, because let's say you might have a very acute situation, but we want to do the edema, or we want to flush stuff through, then the higher hertz is necessary, because that increases the mechanical advantage. It gets more heat in there. Not that you'll really feel it, but it will. You know, you could be at 41 degrees, it'll bring up to 42 degrees. That will increase vasodilation. That will increase the movement of the fluids through the body, and that's where the higher hertz really come in. It's all slightly. There's a couple of things I've never really been able to get my head totally around. But if you look at something like arthritis, again, off the top of my head, I think dorsal. Well, on the setting they have for dorsal arthritis, so arthritis in the upper spine. I think it's round about. I think it is 1500 hertz, 100% intensity. And I'm thinking, why do you want to get more blood through there? But it's just generally what I'm thinking there is, with these arthritis things, the settings that they give you are more on the acute side. But when we're talking about an arthritis like that, it's generally much more chronic anyway. And so I think the starting level is higher. So we're getting the hertz up. We're trying to flush fluids through there. We're trying to get some movement in this area. Yeah, your dorsal arthritis and your lumbosacral arthritis, they're all 1500 hertz. If you put on there, if you go to the setting on the foot, and I'm not totally sure why, but on foot arthritis, I think it's only about 500 hertz they start off. Again, what I tell people is, I say leave the hertz as it is, but that is with foot arthritis. I think we can actually put quite a lot more power in there in terms of joules, because again, midfoot, especially particularly midfoot arthritis, is very, very chronic. The thing is, when they show you the little model on here for the foot arthritis, I changed the settings completely, because on the foot arthritis, it's really talking about some little points around the talocrural joint, and it's also talking about points on the phalanges, the proximal mid phalangeal joints. So in fact, it wants 15 points. You get each one of these a little dose on there. But then maybe it's 500 hertz, because these are they're little joints. It probably is more of an acute situation. And the other thing is the power which is going in there is around about 1.87 joules per square centimeter, which is very, very low. But again, they're very, very small joints. So that's why if we go up to the knee, something like knee pain, I don't know, it's probably about 700 hertz. Again, correct me if you've got the machines on there, I can check on my machine over here. But 700 hertz, 100%, putting more intensity in there, because this will be generally a bit chronic. But your joules will be higher because it's a much bigger joint.
Brilliant.
Does that make some sort of sense?
It often goes over my head, I won't lie, but I'll see if I get some nods and waves from the guys in the.
See if you get any winks. It generally seems.
Thank you, Elaine. Nice to see you, by the way. Yeah, we've got, and it's great. We've got a few of our ACER laser superstars out there at the moment, so watching in, so that's great. But of course, we've got some that haven't, so it's good to see everybody. So thank you. Okay, I've got a couple of questions coming in on the floor, but I've got a load of questions in the bank, so to speak. One of them is actually from somebody that's here today, but just in case she couldn't make it, I said I'd ask a question for her. So this is from the floor in a sense. So with regards osteoarthritis of the fingers, actually, this particular user's not getting great results on pretty much everything else. So happy how she's using the machine and happy with the laser, but not getting great results on osteoarthritis of the fingers. Any tips, any thoughts, increase the joules, anything like that, do you think?
Well, I would start off with probably very similar thing to the what they're using for foot arthritis. Is there a setting for the hand arthritis fingers? There probably is. But I would keep the, let me have a quick check. I would keep the joules relatively low, because we're talking about very small joints. But the thing is, we can always increase it. Let me have a look on here. Hand arthritis, right. Again, yes, they're talking about all these little joints. And from here, actually, I just had a look at it. It is exactly the same as the foot arthritis. Now, you'll see there, looking at that, it's 1.87 joules per square centimeter, as I said, it is on the foot. Very small little joints. And what we're doing is we're setting off more at the acute stage. What is happening generally with these arthritis things, and look, it's more of our mature population who generally have these problems, okay? And they probably have these problems for some time. So it's one of these areas where I would probably, the very first time, I would give you what it says on here. I might possibly, even the first time I go to 75%. You'll see that I'll just stick the joules up from 1.87 to 2.74. I wouldn't have any problems with that. Just get a bit more power in there, because we know they've had this a long time. If they have no change at all after the first time, I'd say, hang on, let's go on a little bit more. Let's give them 100, okay? So we're up there now, 3.6 joules per square centimetre. Then that's the second time. Again, if they've had no problem there, I'd probably come back to 75%, because I don't want to go crazy on this. I'd probably come back to 75%, which will go back to 2.74, but then I'll go CPW, which is actually taking the hertz out of it and it's just keeping this, the 808 nanometers on continuously. And because the two waves are synchronized 100%, that means the 905 is on continuously, no stopping, and it just doubles the joules. But now we've gone up to 5.71 joules, and I'd see how that goes. If that is really not getting anywhere, and this is just that's in 3 sessions, I would then give them the full welly, and I'd go up to 100% on there, which means 7.46 joules per square centimetre, which is roughly round about the same amount of joules you would be giving somebody with, I don't know, a brachial neuralgia, with rotator cuff problems. You know, any of these much bigger joints, but you're putting a bit more power in, but you're gradually building up to it. Don't go straight away up to 100% and then double that straight away. Just go up in stages. So that's why I recommend probably going up to 100% first intensity, keeping the hertz where it is, and then coming back to 75% and then changing it to CPW. And that will just go an interim move up in terms of joules. And then if that's not having an effect, then go up to 100% and the CPW.
Okay, thank you. Let us know how it goes. Mary, yeah? Let us know how it goes. Thank you for the question. Right, I'm going to go to, it's only fair, I go to the questions, more questions from the guys that are here. So Gareth, hi Gareth, nice to see you. Good afternoon. Question from this morning. 82-year-old man, bilateral thigh pain, lateral, very tender groins, muscles strong, but testing quads hurts a lot. Okay to use the laser that close to the genitals? 82, does it matter?
Yeah, don't use it on the gonads. But yes, get close if you want. You're fine. You'd have much more of a problem with the Charlie head, because if you're using the Charlie head, then you might be spraying infrared light all over his nuts, which you don't really want to do. At least with the handpiece, it is pretty directional, and so we want to keep this perpendicular to what we're treating. And yes, you'll be fine. So just guard Steve and the twins. There's no need to put them in a lead box, but just don't go directly on them.
I did encourage that postcard humour then, didn't I? So
okay, sorry, yeah, sorry. I'm probably the wrong person to ask about it.
Well, I hope that answers your question though, Gareth, thank you. Now then, Kathy's testing my pronunciations here. I've just had a Morelli injury in the clinic. He's gone off for aspiration, but will then be in compression bandage for several weeks with the hope that things reunited. I realise that laser is good for wound healing, but have you used it specifically in these injuries? How and what specifically?
Sorry, what was the injury, Steve?
Well, I probably said it wrong. Morelli. Can you see the chat? I'll unmute Kathy. Do you mind me unmuting you, Kathy?
I can't see.
Yeah, sorry, it may be spell check that's done it. It's the name for it's a closed degloving injury, which is common in rugby or other sports where you can get horrible impacts, basically, and it often goes along with fractures of the femur. In this case, the guy's had an X-ray. He's not fractured anything, but he's got this. It's like a degloving where all the it's closed, so you don't see it on the surface, but all the tissue, the subcutaneous tissue above the muscle is detached and scraped upwards. So it's got a massive, basically what you see on the surface is a big lump.
Yeah.
And that tissue is not going to reduce conservatively, so therefore it needs surgery. So it's aspirated because there's an awful lot of bleeding with it. And then as it's quite acute, they're going to compress it with bandages and hope it re-knits to the tissues below.
Yeah, it's a bit like, I mean, a contusion, or the initial thing is like a hematoma forming, but then it becomes a contusion, a massive bruise.
Yeah, it's not just the bruise though, Paul. I mean, the bruising goes down. It's the tissue itself. It will get necrotic if left. So it's got to heal back onto the original.
Well, we want some blood flow in there, but we don't want the extra bleeding. Now, the other thing is, don't use the laser in the immediate bleeding period, which you won't have done, because we are causing some vasodilation there, and we don't want to increase that bleeding. So you want to let that bleeding settle. Really, the bleeding, generally we talk about 48 hours, and that's why I just, if a fella comes with a massive rugby player, massive cork in his thigh, and he says, look, you got your special machine, can you do something about it? I say, no, go away, 48 hours, 48 hours, rest, ice, compression, elevation, waking yourself up 3 times at night, more ice, okay? We've got to stop the bleeding. After 48 hours, I'll come and see him, but I will still assess it then, because if I still feel there's any still bleed going on, it's another 24 hours, so up to 72 hours. Now, after that, the bleeding, the active bleeding will have stopped, okay? We still want to keep compression on there, and that's when we can really start going in with the laser. And I would suggest you even use on there the contusion setting. You might want to just try and get rid of some edema. Just give them a run over with the anti-edema setting, but then just get in on the contusion and work on there, because that will actually increase a bit of blood flow to the area, but natural blood flow, because we don't want necrosis. We've got to get a blood flow to it. And then just as long as you've got bandages to actually rewrap that and get the compression on there, I would say that would be a great thing to try.
Okay. Thank you.
Thank you, Kathy.
But yeah, use it. Never use it in the active bleed stage.
So could I use it over the compression bandage?
No, because it's not going to go through the compression bandage.
No, okay. I'm just.
But you'll have to take the compression bandage off, and something like what would be, look, that would be an absolute perfect situation to have your Charlie head, where you can really in a very short period cover a very large area, and get the laser light in there, but very quickly, and then just get the compression bandage back on there.
Mm-hmm. Yeah. Okay.
Okay.
Thank you.
Thank you. And actually, Charlie had mentioned again, going back to Gareth's question that we just had, he doesn't have the Charlie head, just on quads insertions. Does that change anything in any way for you? That was our 82-year-old.
Well, the insertion is really coming into the patella. Is that what he's talking about, in the patella, or actually? The origin's just up in the femur.
Let's let Gareth come in, if you don't mind, if you're happy with that, Gareth. Just taking a second to unmute Gareth.
Because with the quads, obviously there's 4 muscles and there's 4 different origins. Vastus medialis is on the femur, vastus lateralis on the femur.
Gareth's text message saying the origin.
The origin, right? So what we're talking about, get working on both sides of the quads, of the vastus medialis, vastus lateralis, and for the origin of the rectus femoris, come right up into the onto the AIIS, I think it is, the anterior inferior iliac spine. So right up there, and so work on all these.
Brilliant. Okay, thank you. All right, I'm just checking. I've got no questions on here. If not, I'll go over here.
Oh, I'm having to remember my anatomy from a long time ago. This is
this is good homework for you. Okay. Oh, did someone say something then? Someone asked something then? No. Okay. Right. Rebound effects got brought up a lot in previous webinars. had a question on our laser forum this week. Been quite a busy forum this week on our laser forum. Is it possible to apply too many joules of energy into an area and make it worse?
No, no. As far as I am aware, you're not going to make it worse. The body is going to be very unhappy. What I gently tell people, and if we do get the rebound effect, which we can do, and I've known from a couple of users who have just done some treatment and said it's felt a bit better, and they've gone in straight away and then just think, if it feels better, let's just whack it with the whole load of everything we've got here, and then it's got worse. And it's the actual condition won't really have got worse, but they will be getting more pain from this rebound effect. I tell them, generally up to 48 hours you'll feel the rebound effect, and it should then settle down after and be back where it was, if not slightly better. I think we could probably extend that a little bit if you've really hit them hard with this, up to 72 hours, but generally it should come back and it shouldn't make things worse.
Brilliant. Yeah, okay, great. That's brilliant, thank you. Here we go. So actually, on a similar vein, I've got a particular user, typically sometimes wants to increase the intensity if they want to give it a kind of, let's say, a harder hit. Is that the best way, or would you alter the hertz instead if you're trying to increase that?
By altering the hertz, I think we're getting more of a mechanical effect, but you're actually not, you're not changing the joules massively. If you increase the joules on something, you'll see the hertz will go up, but very, very small, okay? And so if you want to do a very small increase, you can actually add some more hertz. But then consider what is the nature of the condition. If we don't want to get too much of a mechanical effect, then probably adapt the intensity. What I tried to explain earlier, we've got this lovely, amazing tool, this CPW, the continuous wave, but using it sparingly, but also use it grade up to there, because what you'll do is, just by pressing on CPW, because you're bringing the 808 nanometers on all the time, therefore you're bringing the 905 nanometers all the time, you literally double or over double the joules straight away. What I tell my patients, not regarding the laser, but it all fits in totally together. I say, anybody who's listened to my webinars say that the best doctor in the world is a doctor called exercise, okay? The second best doctor in the world is a doctor called Mr. Diet as well. And the third best doctor is a doctor who's called exercise as well. So this is the whole thing. Now we need to exercise because we've got to change the tissues. The way to change tissues is to stress the tissues. But what I tell every patient, and this is the most important thing, you've got to stress them very gradually, progressively. You don't go from one level and then go massively to the next. I used to work in the military. We'd get these squaddies feeling great, and they say, right, I'm fine now, thanks, you discharge me. And I know exactly what they were going to do. I said, well, I'll see you next week. They said, no, I'm fine now. And I would see them next week, because what they would do is they'd go out, having had a knee problem, they would stick a rucksack, a Bergen on their back with 25 kilograms in and run 8 miles uphill. And guess what? They're back in the next day, because the tissues will fail. If you stress something too much, it will fail. Exactly the same with using this, CPW by going up. What I tried to show you was going from 50% to 75%, trying that, then 75% to 100%, trying that. Now I've got a CPW, but I wouldn't go straight in with a CPW because that would double what we've already got. So I'd bring it back to 75%, then press the CPW, which will just incrementally just bring it up a little bit more. So we're not then suddenly hitting them massively with huge amounts of joules, which would most likely cause a rebound effect. We're just bringing up little stages. So play around with your machine. Don't be frightened of that in any way. Just always then check what we're doing and see how much that affects the joules. And by playing with the machine, you'll suddenly realize actually we can change things very incrementally and bring it up very steadily. But to go from 50% straight to 100% and add a bit of CPW, you're just asking for a rebound effect.
Brilliant, thank you. Question to the audience. Are you all happy with the terminology of CPW and FPW? Do you know the difference, particularly our users? Are you happy with that, or is that something you'd like? Thumbs up, thumbs down, nod of the head, if that's something that would be helpful. I think everyone's okay.
I mean, I can just very briefly go on there, if you want me to.
Go on then, go on then. Yeah, because there are people that are not users, so that might be useful.
I can even bring up my little drawing, if I can find it. Oh no, where's my drawing gone? Oh, I've got my drawing. Yeah, right. What there is, the settings on the laser are all generally. The default setting is 808 nanometers continuous, but it's inverted commas because it's not truly continuous. You've got 808 nanometers at 1.1 watts sending in power. You've also got synchronized at exactly the same time 905 nanometers of light, which works on inhibiting pain pathways. It's sent in at 25 watts. Huge amount of power, would normally cook you, but it doesn't. Because it's super pulsed. It's on for a nanosecond, off for a nanosecond, on for a nanosecond, off for a nanosecond. Tissues heat, cool, heat, cool, heat, cool. So you don't get heat above 42 degrees centigrade, which you will probably hardly feel, but you're getting this huge amount of power in there. Right, what happens is, that is FPW. And I've got to admit that the screen on here is slightly confusing, because when I look at it just as it is, if I put on, I don't know, one thing, something like that, blah, blah, is a massive CPW. So you think that's referring to it? It's not. That's what we can get. Now, what we're talking about, FPW, is frequency, okay? And if you've got this, and we've got, when we put it up, we'll have a frequency with the hertz. I know, let's say 700 hertz. We've got 5 minutes. We've got 50%, 5 points. Okay. What happens is, if you press the CPW, the hertz box will disappear. It will just go because there is no longer any hertz. So actually, that continuous wave is not really continuous. It's frequent. So, but it's in terms of comparing it to a super pulsing, it is on for a long time. 2000, if you have the hertz very high, 2000 hertz a second, it's on for ages compared to a nanosecond, a millionth of a second. So let me show you my drawing. For those who can see this, but your this is what we get on the default setting, 808 nanometers on the FPW. It looks like CPW because it's a big CPW, but that is the FPW, that's the frequency wave. So it's off, it comes on and it goes off. And it comes on and it goes off, and it comes on and goes off, and comes on and goes off. When it's on, because the 905 nanometers is synchronized to it exactly, it's going, the sound effects are optional. Well, no, they're not optional, compulsory. It's going through so many times, just through while that's on. Then everything goes off. It comes back on, 905, going crazy through it, off, back on. Going on crazy, off, back on, going crazy. Right, now what happens is, when we press the CPW button, this frequency thing disappears. The 808 nanometers just comes on all the time. It's on continuously. And unfortunately, I haven't drawn it in because I don't, and I'm not going to change it because I don't want to ruin my lovely drawing here. But because it's totally synchronized, this is going diddly, but it's carrying on all the time while that's on. So it's going and so on, right through. So what we've got is literally just a doubling of the joules straight away. Now, that is all relevant to what the hertz we've got, or the intensity we've got. If we bring the intensity down, it's going to bring the whole thing down, so we're not going up in levels too much. I.e., if we're 50% and we go to 75%, we'll get more power. If we go up to 100% and then we put CPW on, that you can't get more than that, but that is going to, you're not going to use that unless you've got the most chronic situation, or the time where I use CPW straight away, and I've said this before, is if I've got a mature person who's come and moaning of their osteoarthritis in the knee, they've seen 20 physios and nobody can do anything. Am I still there?
You are, but you get me into trouble. You get me into trouble. I've given you nice graphics and presentations in the past, and you still use your...
My drawing is much better than that.
Feeble, Tony-hearted impressions. So,
what's happening is we can actually go up in increments, and that's the whole thing. You can't, if you put in so much power. The only time I would ever use it is on a knee arthritis, big bone, everything like that. And I'll go in with what the setting is, and I'll go CPW straight away. And actually, we start getting some changes straight away.
Brilliant. Thank you, Paul. Sorry, I didn't mean to interrupt you there, but
no, not at all.
The effects were brilliant. The drawing was, you get me into trouble, you do. I give you these nice presentations and you still insist on ignoring them.
I do prefer my drawing.
If the Italians see your drawing compared to my presentation, I'll have a Charlie's head on my pillow. So, okay, right, great. I think I had another question here from Gwyn about some tennis players. Let me go to chat. There's my chat gone. I'm sure I saw that. Paul, I have a patient that plays tennis a lot and primarily backhand, so has a bit of tennis elbow and golf elbow. What would you suggest? Thank you, Gwyn.
He has tennis what elbow?
Tennis elbow, a bit of tennis elbow and golf elbow. Okay,
we've got both. Right. What I would suggest is, as I've said in every webinar I've ever done, which is something which Celtic probably don't want me to say, but no machine is the answer to everything. And it's not, because going back to what I said before, tissues adapt to the stresses we can put them under. Where this machine is just brilliant is actually starts the regeneration of the tissues and reduces pain. What we need to do is, with the tennis elbow and the golfing elbow, yes, use the laser, but what I'd probably do is I'd start them with an eccentric loading program. For the eccentric, for the tennis elbow, resting the arm on that with a weight in and slowly letting it down, bringing it up, holding it, slowly letting it down, bringing it up, hold. So we're working that as for the whole extensor mechanism as it's getting longer with the weight, okay? Equally, then we turn them over and we'll, with the golfer's elbow, for the flexor mechanism. I hope this is making sense to you, but this is resting on the bed there. We bring this up with our other hand, holding the weight, and then slowly let it down, okay, all the way. Don't bring it up concentrically, bring it up with the other hand, slowly let it down, okay? Bring it up, slowly let it down. Again, I would use the Hacken-Alfredson protocol, which is used for Achilles tendonitis. I would do 3 lots of 15 3 times a day. Now, it's actually a bit easier with this because they can be at their desk doing this on the desk and they can still carry on with the work. So there's never any excuse for not doing that. The only problem with it, really, you have to do 3 lots of 15 with the arm straight and 3 lots of 15 with the elbow flex. And the problem is, if you're doing both the golf elbow and the tennis elbow, you've got to double that again. So it's a shed load, okay? What I would really consider with that person, see what is the worst problem. I would actually deal the laser on both sides, do that with the settings that they give you. Again, depends how long they've had it. If it's very chronic, you can add a little bit more power in there. But I'd use that, don't go up too quickly. And I would concentrate on what is probably the worst. You know, working on the mouse and stuff is really killing them because of the elbow here, or picking up cups of tea or any grabbing. And it's usually the extensor mechanism, which would be worse. I would tell him to start doing the eccentric loading on the extensor mechanism and leave the flexor mechanism, but work more on the extensor mechanism you have to tell these people as well that the problem is we're probably starting a new inflammatory reaction with what's going on. The great thing is, I said do the laser afterwards because that will reduce pain straight away and reduce inflammation straight away. And what we're doing is we're starting a new inflammatory aspect by breaking the tissues, bringing it back. And then if you use the laser afterwards, you'll actually calm it down straight away. Before we had the laser or people were using anything like that, Hack and Alpertson's advice would be, you do this and you do it as much as I've told you. And the only reason you don't do it is if the pain is just so bad, you literally can't do it, which isn't a good advice to give to your general public, but that's what he would give the advice. But he was dealing mainly with elite athletes. Now we've got this wonderful little machine. We can actually reduce that new inflammatory action we're making and make it much less painful, along with the 905, which will be inhibiting the pain pathways. So we should, it's a good example, we should be able to get these people to do this. Again, start off very low and just very gradually progress week on week with slightly more weight as you're able. Don't get a 5 kilos and start doing that straight away because you're going to cause too much of a problem. Start with a tin of beans, literally a tin of beans, doing that, boom, tin of beans, and then you can move on to something a bit more.
Brilliant, thank you. Thank you, Gwen. Yeah, thumbs up from Gwen, thank you, that's great. Another question, just going to go back a bit from Brendan. Hi Brendan, not said hello yet, nice to see you as always. Is there any advantage to leaving the hertz and intensity low, but leaving it on the area longer than the prescribed time period? Interesting.
Well, again, by adjusting that, you're just, I wouldn't say there's a big advantage because it comes down to how much joules you're putting in. The longer you have it on, you're going to increase the joules in there. So what you're doing is putting lower intensity, everything like that, and putting longer time. You're just making the treatment longer. So it's as far as I'm concerned, we're wasting time slightly. What we're still delivering the same joules, unless you leave it on for much too long, and when the joules are going higher, which you possibly could. And I suppose it could be argued that if you're trying to get more joules in there and you want to do it not as aggressively, then it might have an effect. But I wouldn't bother doing that. I would actually use, the times are very set up very nicely to get the maximum benefit out of the time we've got to get the joules we need in there in that time.
Patience.
I just add one thing, Steve.
Yeah.
It's probably worth, hang on, I found this now. It's probably worth just making comparisons. When you go through a lot of the settings on the laser, different areas, different parts of the body, but you can pick up very, very simply patterns. If you're ever worried about what you should use, pick up patterns of what's going on. Let's say a hematoma and a contusion, obviously different things, but generally, your hematoma is more fluid. You'll see that anytime you see a hematoma at any different parts of the body, it's generally 1500 hertz. Contusion, which is just like more of the bruise in there, stuck in there, it's a slightly lower hertz, so that's 700 hertz. What's interesting, no matter what different hertz they use, so much of these things come down to the joules being roughly really between 4 and 9, or 4 and 8, I would say. So many of these things are actually brachial neuralgia, 7.4 joules per square centimeter. Sciatica, 7.9 joules per square centimeter. Rotator cuff, 7.95 joules per square centimeter. Muscle strain, 7.65 joules per square centimeter. When we have a tear, it's more acute. The hertz are slightly higher, but the intensity is lower, and it's 5.24 joules per square centimeter. You can pick up little patterns. And what's very interesting about this, I believe that Scott Sigmund, the fellow who's been doing the trials on for reducing inflammation in the lungs in America. I think they were using 7.6 joules per square centimeter, which is rough. It's right in the middle of so many of these things. So that's why when we start sticking in big joules, it's not always, I'm not always totally comfortable with that unless it's a really chronic situation. Obviously, Scott Sigmund is working on people with an inflammatory pleura in the lungs and stuff like that. But again, it's acute. All these things are generally acute. So going back to what the settings they give you, they are all roughly set on the pathology for acute, subacute. If it's a very chronic thing, that's when I've got no problems with going up with the intensity and adding CPW if we needed at some stage, or bring the intensity back, adding CPW and get there. But don't do that unless it's a real chronic problem.
Thank you, Paul. Now, Paul, Brendan's just reminded me, and I almost missed it, so thank you, Brendan. Brendan sent in a question a little bit earlier, not too dissimilar to what you've just been talking about, actually.
Yeah.
Let me go to the question on an email. So Brendan's got the ASO laser with the Charlie head, the non-robotic one, so the MP5. I don't know if you've got the answer to this, but we will follow it up for you, Brendan. But as you've reminded me to ask, I'll ask it now as well. Can you please send on what protocol I can use for someone who is asthmatic or have chest complaints? Brendan's been using it on his wife, who's experienced some chest tightness, who is asthmatic for 15 minutes on each lung for 2 days, and she found relief afterwards. Well, that's amazing. That's brilliant.
Well, that sounds not too dissimilar from the settings which Scott's doing.
We'll be able to find out for you, Brendan. Yeah.
Well, what I would suggest on there is, well, first of all, were you doing it from the back or from the front, Brendan? Were you a bit like Scott saying, were you getting them prone and coming into the back? That is
I was doing it from the back with her hands underneath her chest to expose the lung area.
Right. Okay. The other thing is, when you're using the laser, if you have it some distance, we are losing some of the power. So again, off the top of my head, if I think let's say you're doing biostimulation, what I tell everybody is, because most people I'm teaching have got just the handpiece, and what we need to do is, we need, for granulation purposes, to make the tissue heal, we need it between 1 and 4 joules per square centimeter. Going out there, you'll start doing the opposite. You don't want to do that. You want to keep it in that between 1 and 4 joules per square centimeter. If you look at the Charlie head, if you set that up for a biostimulation, I've got a funny feeling it's probably around about 7 joules per square centimeter. But what happens automatically when you're a distance away, you've got, with the Charlie head, you've got 3 of these heads all focused in at 20 centimeters difference, and we lose some power. So it's all worked out exactly what they need to do. So when it's actually hitting the tissues and going into the tissues, that's what we'll be getting within the tissues. So, you know, I was thinking, well, I've got to read back on that Scott Sigmund thing, but he's putting 7.6 joules in on the system, but when it's gone through and it's actually hitting the floor of the lungs, I've got a feeling it's probably only around about the power which is hitting the tissues inside is probably only about something like a half a joule, which is, but then we are talking a mega and acute situation, and we're keeping this right down. So yeah, very interesting question. And I could imagine it worked because we're actually clearing inflammation within the lungs itself.